Good evening. I am Dr. Deepthi Kondagari, consultant endocrinologist at Endoruma Care, which is a specialty center for diabetes, thyroid hormone disorders, and rheumatological conditions. On this World Diabetes Day, I thank Vijaya Diagnostics who had invited me to speak about the diabetes issues and to increase awareness among people's minds. With increasing penetration of technology into people's lives in the form of smartphones, increasing access to social media and other lot of knowledge platforms, a lot of information about diabetes is now very widely reaching people. But a lot of not so correct information is also entering into people's minds. So, on this World Diabetes Day, this is an initiative to empower, educate, and to increase awareness of diabetes and its issues and its management methods among people's minds. So, what is diabetes? As everyone considers, and still an existing social stigma, a lot of people consider diabetes as a disease. But it's a gentle request to all of the people, please do not consider diabetes as a disease or a problem. It is a metabolic issue wherein the body's ability to utilize sugar, which is the energy source for the body, that gets impaired and the body is not able to utilize it as a fuel. As a result, a lot of sugar gets accumulated into a person's blood, wherein it leads to damaging effects. It gets converted into toxic compounds, which have their damaging effects in all areas of the body. It is predominantly a metabolic disturbance and not a disease as such in the pathophysiological point of view or the problem where it arises. So, why is it important to understand about diabetes? If you see the figures, close to 77 million people living in India are diabetic. And now India is on its way to become the world's capital for diabetes, ranking second to China. And why is this happening in such a big way? There are a lot of factors influencing this. One is the increasing availability of or increasing lifestyle changes that's happening, rapid urbanization that is happening, a drastic change in the kind of living conditions of the people, a lot of sedentary behavior maintaining because of the work schedules or the work preferences of the people, a lot of unhealthy diet patterns that are existing in the society, and lack of awareness about a few small things which can be taken care at the early stage. So all of these things have created the impact in such a huge way. If you see, every one out of seven people globally will be an Indian among the diabetic patients. And also these figures are going to increase dramatically over the next 20-25 years, wherein the numbers will increase by close to 50% if this rate of multiplication continues to stay. So in the long run, it's going already. It's a huge impact to the Indian economy, which is actually quite a bubbling economy. But if this continues, it's going to be a huge burden, both economically as well as the social or the societal development of the country as well. So this is the reason why everyone should be aware of an issue which is actually, if it's not 100%, but to a lot extent, it is preventable as well. So, what is the importance of understanding how this creates issues? So, it's just not the blood sugar levels increasing, but the impact it causes in the long run over a person's life and his performance and in lot of different areas of his life. So, uncontrolled or undiagnosed diabetes in the long run can lead to simple issues wherein simple wounds or bruises are not failing to heal, becoming bigger issues, to even a huge impacts in the form of increasing risk of heart attacks, increasing risk of kidneys failing to work properly, where we call nephropathy. When damage to the eye nerve, they call retinopathy, can lead to vision loss, and increased risk of strokes or the paralytic attacks, and increased risk of damaging a person's nerves to his limbs, wherein it can result in the amputations or the limb loss as well. So, uncontrolled or untreated diabetes can translate into a magnificent level of problems in the long run. A lot of studies done in the patients living with diabetes previously have shown that early management and an aggressive management of diabetes in its initial stages can reduce or even avoid the development of these complications in the longer run. Hence, the need to understand what exactly happens in diabetes and how do you manage the diabetes. So, be it any form of diabetes, ultimately the foundation stone to manage diabetes stands at the lifestyle level. So, diet, having a healthy and a balanced diet is very important first step, and then maintaining a regular physical exercise close to 30 to 45 minutes per day, at least 5 to 6 days a week is a recommended minimum physical activity. And having a good adequate sleep, a good healthy sleep again reduces the levels of stress hormones in the body and also helps in ensuring better sugar control in patients with diabetes. So these predominant lifestyle factors contribute to close to 50% of the management in any diabetic patient, and this is followed by a proper consultation with your proper treating doctor, and following the medication, whatever be the form of medicines prescribed, on a regular basis with close follow up with your treating doctor. Again, the word regular usage of medicines is quite important here, because we see many times a lot of patients use medicines, and as soon as the sugars get controlled, they stop them abruptly, realizing that they don't realize the fact that it can again recur after some time. So any change in medicines with your physician the consultation is important, and do not stop medicines suddenly as soon as the sugars settle down, because they are bound to increase again. So these two pillars form the basic foundation pillars in management of any form of diabetes. So diabetes again, if you want to understand how many types of diabetes are there, people generally have an idea of type 1 diabetes and a type 2 diabetes. So type 1 diabetes is a condition wherein the body is not able to produce enough insulin, which is a hormone produced from the pancreas. It is responsible to use the food or the fuel that we take into the body in the form of sugar, and it should convert it into energy for the body to be able to use it. So this function is maintained by insulin. So in situations wherein body is not able to produce insulin in adequate amounts, those people again end up having high blood sugar levels. This forms the core of the kind of diabetes that we call as type 1 diabetes. In type 2 diabetes, the production of insulin is there, but it is not either adequate enough, or whatever is produced, the body is not able to use that insulin effectively enough. A state what we call as insulin resistance. So this forms the core of the type 2 diabetes. But there are not only two different types of diabetes, but there are a lot of other forms of diabetes which have a varied spectrum varying between these two ends of the problems. That is either insulin not being adequate enough, or insulin produced is not acting enough. So a mix of these problems can again give rise to different forms of diabetes also. Also, there is a form of diabetes called gestational diabetes, wherein we see the patient is a pregnant woman who's not able to utilize the sugars in the body effectively enough. So majority of the situations, the diabetes tends to go away after the pregnancy is completed. But again, there are a few areas wherein in which it does not completely disappear after delivery as well. So this is another form called gestational diabetes. And then there are the group of diabetes caused by a lot of other conditions, which can be related to the damage to pancreas, which can be because of a lot of other medicines that are being used for other problems, which can be because of the genetic defects in the cellular level at the mitochondria. So a lot of other these genetic factors can also create different types of diabetes. So the type of treatment that we decide for a diabetic patient again depends on the balance of these problematic areas. So treatment ultimately depends on what is the predominant problem in that patient. Is it deficiency in the insulin, or it is that insulin that we give that is already present in the patient is not actively working enough. So the crux of the treatment is based upon these two factors. And treatment options range from whole lot of oral tablets to injectables as well. Nowadays we have seen a lot of development in the kind of tablets or the medications that are available to the diabetic patients, and the research is going on continuously to further improvise the management of diabetes and to closely mimic the body's natural functioning status with these medicines as much as possible. And whole lot of new medicines that have come into in the recent times are also showing promise, not only in controlling sugars effectively, but also extending their protection to prevent other complications in the form of reducing the risk of heart attacks, reducing the risk of heart failure, reducing the risk of progression of kidney problems, and having extending protection against paralytic attacks also. So the broadly speaking, the outlook of diabetic patients is definitely not grim, and it is going to be even more better and better as the technology and advancements in science and research progresses. So I always tell my patients, though even if you're diagnosed as a type 1 diabetes, do not be heartened because of the fact that the child or a patient or a young adult has to start insulin. But the developments are in such a way that probably after a few years, patients will have the availability of oral insulin or probably weekly once insulins, wherein they don't have to poke themselves every day. So even in type 2 diabetics, also the developments are going on quite well. So we will get to see a lot of new medicines which will help in patient taking control of their diabetes as well in the most effective way. There are a lot of there are things on patients' minds regarding diabetes, and still a lot of myths exist among people. I'll try to address few myths that patients commonly have and patients commonly ask in our clinics. So patients always think that eating a lot of sweets can cause diabetes. So by eating a lot of sweets, a person will not end up being diabetic. Diabetes results as a result of a lot of other factors. As I told you, the body's ability to utilize sugars as energy, or the body's ability to manage sugars in a best possible way. If that is defective, then diabetes can result. It will not just happen because of high sugars or high sugary items consumption. Yes, consuming high sugary items or sweets on a long run in a regular basis can make you become overweight and obese. Hence, for the worsen the chances of developing diabetes, but it will not directly per se cause diabetes. And a lot of people also think that diabetic people should keep eating regularly, every 2 3 hours, 2 3 hours. The fact is that the reason why we advocate snacks, or the plan is to have a timely eating schedule, wherein your medication, whatever being prescribed for controlling blood sugars, should match the body's natural rhythm of having sugar peaks and lows. So, if the patient is constantly eating, the medicine effect will not match the regular spikes in blood sugars happening very frequently. So, we advocate a person having to have three major meals a day, and to have a very small, low calorie snacks in between the major meals, to avoid the risk of either low sugar happening, or to have the adequate energy balance to be maintained because of the kind of a diet plan that we prescribe to the patient. So the idea is to have a proper meal, breakfast, lunch, and dinner, and to have a very small, light, low-calorie snacks just between breakfast and lunch, and between breakfast and lunch and dinner. But there's no need for for a patient to keep eating every 2 to 3 hours. And patient also think that diabetes affects predominantly the obese people. I am lean, so I should not be getting diabetes. This is not true. The fact is that a lot of obese patients are at risk for diabetes, and usually good number of them end up having diabetes. But there are also obese patients who have absolutely normal metabolic health as well, and we often see situations wherein patients are really lean but end up having high blood sugar levels. So as I've told you before, the risk of getting diabetes again depends upon how much the body is able to manage the sugars. So if there's any issue with the body not being able to produce enough insulin to manage sugars, even if you are lean, you can end up having diabetes as well. And people also have this conception about insulin. They think whenever the doctor prescribes insulin, it is going to be a very serious issue, and a lot of people hesitate to start insulin when prescribed. So the usage of insulin in a diabetic patient depends on a lot of other factors. It's not just by blood sugar alone. Situations wherein patient is undergoing some surgery or procedure, or situations wherein people are planning for pregnancy in the near future, or already pregnant. So these are all situations wherein we request, or we ask the patient to use insulin for as long as it is required. And once the situation tides over, or the condition which demands the usage of insulin tides over, we do attempt to get them back onto oral tablets as well. And there is also a situation wherein a diabetic patient has been using medicines or oral tablets for a very long period of time, probably more than 10 12 years. and after using them for so long, the patient does not see the blood sugars getting maintained very well. Then there is a stage that they need to start insulin, but that also does not mean it's going to be a serious issue, because it's given to avoid getting complications in the near future because of uncontrolled sugars. And insulin is not going to be damaging the body or harming the body in any way. And in any situations wherein a body has serious issues, then also insulin is one of the safest medicines to be used. Also, people have this very strong convention that a lot of people, when they come to OP and we ask them, why haven't you started medicines in spite of knowing sugars for so long, they always say that if once we start medicines we will get used to it. It is not the fact that you once you start medicines you get used to it. The fact that the sugars are continuously staying high means that there is a need for you to take medicine. And when you start the medicine and the sugar gets controlled, it's with the effect of medicine and the few changes that we have suggested as per the lifestyle that you are doing, which is helping for the sugars to stay under control. It is not that body is dependent now on medicine to control sugars. It is that the medicine is helping your body to control the sugars in a best way. And the same goes for insulin as well. A lot of people again feel if you use insulin for sometime your body get used to it. It is not so. As I've told you earlier, there are demanding situations wherein you have to use insulin, but you can also come out of it if the situation tides over as well. And patients also say that they are worried about using tablets for diabetes, because the tablets are known to damage kidneys and liver and all. It is not that tablets are going to be damaging your kidneys or liver. It is the high sugars which left uncontrolled for a long period of time, which are going to actually damage your kidney and liver. Usage of medicines at proper time under doctor supervision will not harm your kidney or liver. And your doctor advises you to come for periodic checkups and advises you to undergo few tests on a regular basis, especially to monitor how well your kidney functioning and liver functioning is getting maintained while being on tablets. So when ongoing monitoring is happening and when you're under proper supervision, you can definitely forget all worries and safely use the medicines prescribed by the doctor. Whenever there are situations wherein usage of a medicine is not going to be safe for the patient, your treating doctor will definitely tell you. And there are also things about diabetes in patients' mind, that diabetic patients cannot play sports or cannot have an active, healthy lifestyle. It is not so. This is all, especially the main concern in patients, especially diagnosed with type 1 diabetes, who have to stay on insulin ever since the diagnosis is done. Uh, Even if patient is diagnosed as a type 1 diabetes, they can lead near normal life as possible if they properly follow the precautions and they properly take the advices of the doctor. uh, Taking your medicines properly, having a proper timed and healthy eating plan, can help your blood sugars to stay in the near normal range as much as possible, and it will not affect your functioning in any way. You can be as normal as any other person. Only precautions that you need to follow is that if you're planning to go for heavy workouts, have a snack before you go for a workout. If you have been put on insulin, don't forget to take your snacks with you, because if you feel weak or low during workouts, you can have your snack immediately. And monitor your sugars before and after workout, and see what is the kind of precautions which best suit you, either reducing the dose of insulin or increasing the snack intake, and then customize your schedule according to that. So these small precautions can help you manage your day-to-day activities in the best possible way. And a lot of people think that diabetic patients should stop eating rice or should not take carbs at all. So this is not so. Uh, any diabetic patient, the advice on meal predominantly is to have a balanced, healthy meal. So they need to have a balance of the amount of carbohydrates that they are taking, the kind of protein and the fat intake that they are taking. And regarding carbs, because carbohydrates are the predominant source of glucose in the body, the type of carbohydrate that patient is taking is more important, and as well as the load of the carbohydrate that patient is taking. So speaking in simple terms, if whatever diet you are taking, you should see that the amount of sugar content, say the degree of sugar rise that can happen with a food item, should be cut down by adding other components which will reduce that spikes in the sugar that you can see. Say if you have 2 bowls of rice, the degree of sugar rise will be to a certain degree, but that degree of rise in the sugars can be cut down by adding a big bowl of salad, big bowl of dal along with the rice. So this is the way that you need to manage your diabetes. You need not avoid rice altogether, but try to have a balance wherein you have a small portions of rice which are actually containing refined carbohydrates, or which can actually increase your blood sugar levels a bit more, but balancing it with a healthy intake of whole vegetables, which again have a lot of fiber and do not raise the blood sugar levels to a very high levels, and adding a good portion of protein, which will actually body takes a long little more time to digest, and the energy consumption will be more with protein content, and little portion of healthy fats to give you the energy that is required for active functioning. So rice in moderate portion along with a whole lot of veggies and dals can be taken for one meal. And the focus should be on having a bigger meal, a little bigger meal for the breakfast, a little less bigger meal for the lunch, and a very, very lighter meal for the dinner. This helps in having your metabolism up and active in a very good way. And so we'll see whether we have any comments from the audience as well, and I'll try to address a few of their queries. So, what are the common symptoms of diabetes? Uh, Diabetes always will not create any symptoms. A lot of patients just walk in for some health checks and we pick up them being diabetic. But if you have diabetes, these are the few of the common symptoms that you can see. You can see uh, fatigue, weakness. You can see tiredness. You can see increased hunger. You can see weight loss if the sugars have been very high for a very long period of time. You can notice increased frequency of urination, especially in the night times. You can see profuse sweating, even with milder, much smaller activity loads. You can feel dragging pains in the legs and hands, and if you're not eating for some more time, you can feel unusual shivering and hunger sensation. So you can also notice few of the small wounds not healing properly. So these are the few of the common symptoms that you can notice once you start developing diabetes. People also end up have small infections happening in the urinary areas, wherein we actually they go to a treating doctor to get treated, but while evaluating they pick up that that the person is now becoming a diabetic. And other form wherein you are unusually putting on weight for a very long period of time, then also you should get your blood sugars checked, because that also can lead to diabetes. What food I should I really avoid if I have diabetes? Can I have rice? So as I've already addressed that, you can have rice in moderate portion, but mix it up with other items wherein the load of blood sugar rice can be cut down. And other food that you can have is prefer a whole lot of whole vegetables, that is slightly boiled cooked vegetables or raw vegetables in the form of a salad. Try to have a small bowl of salad in each meal, which will actually help in adding fiber to the diet and reduce the blood sugar spikes. And lightly boiled cooked vegetables. Avoid deep fried items, and try to have lentils, pulses, legumes in the form of chana or rajma, or even dal, a ball of dal in each of your meals you can have. And have one portion of fruit, that is semi-ripe fruit, in the form of snack in the evening, or mid-morning snack. You can have egg whites, you can have whole egg once or twice a week also for the protein requirements. And among non-vegetarian items, you can prefer more of lean meats in the form of fish or chicken, but avoid red meat. What are the early signs of diabetes? Uh, as I've told you, the previous symptoms, you can have either weakness, unusual, unexplained weakness, tiredness, pains in legs and hands, and increased urination, increased thirst, increased hunger. And if you have a family history of diabetes, then you definitely are at a slightly increased risk than the common person who does not have a family history of diabetes. But because of a lot of other environmental factors or the changing living conditions of the people, almost every person who's living in a Southeast Asian region is prone to develop diabetes during any stage of his life. So when you know that your family has already a history of diabetes, you what you can do is you can have take the adequate steps or the precautionary measures to prevent the onset of diabetes. Because you fall in a high risk category, you can have a preventive health checkups done to know whether where you stand, where your metabolism is standing right now. And if you have little weight issues, you can focus on losing little weight, having a healthy weight schedule, having healthy weight management schedule in the form of a good diet and exercise plan can help in preventing or even at least postponing the onset of diabetes in you. Do I need to follow a low carb diet? So, for the management of diabetes, these fat diets in the form of low carb or high fat or high protein diets actually can give you good results in the short term, but their long term viability is still questionable. Our South Indian diet is actually a kind of a more diabetogenic or diabetes favoring diet. So, a small adjustments in the diet pattern can help you achieve better maintenance of blood sugar levels. But I always advocate the patients to follow whatever you can follow on a long term basis. See, if you are able to do a low carb diet for a month or two, you definitely will see the results. But will it sustain if you once break the diet, and will you be able to see the results sustaining to at least a year or so? It's questionable. As soon as you change the diet pattern, the body's tendency to again manage it tends to again lose over some time. So whatever is manageable on a day-to-day basis in the long term is the best policy to follow. So have a healthy portion of carb, fat, and proteins, and distribute your carbs in a way to have more of complex carbohydrates, high fiber rich items, and a good portion of high protein diet. Should insulin dosage be adjusted depending on food intake? Uh, yes, definitely. But if you are able to understand what kind of food you are having and how much the food can create fluctuations in your blood sugar levels, please do adjust insulin accordingly. But if you're not sure how much it is affecting, please do not attempt doing it in the early stages, because any mismatch between the insulin dosage and the food intake can end up giving you a high sugar or a low sugar episodes. So we advise the patients to stick to a more or less close diet schedule as much as possible that you're maintaining on a regular basis. Any deviations occasionally that happen can be managed by adjusting the insulin dosage as per the requirement. Do I need to exercise if I want to control my diabetes? Yes, exercise forms one of the core aspects to manage diabetes. Uh, if you're not able to do usual recommendation is 30 to 45 minutes of regular moderate intensity. That is, your heart rate should increase. You should start sweating. So this is a moderate degree intensity exercise that you need to do as much as possible, almost majority of the days of the week, for you to have a metabolism functioning in an appropriate way. But if you want to lose weight or plan a little more better improvement, then you can focus on adding weight lifting exercises, other strenuous activities as well. uh, I have heard we have to eat every 2 hours if diabetic. Is this correct? So I've already addressed this question. And what should my blood sugar levels ideally be? So, if a person is diagnosed with diabetes and he's already started on medication, then we try to target your fasting blood sugar levels in the range of at least 90 to 120, and your after food or the random blood sugars should always stay between 140 to 180 milligram per deciliter. Again, there's a slight relaxation that we kind of allow in very elderly patients or patients with other existing health issues. But more so, this is the range that we try to target in young, healthy, and fit individuals, wherein we can try to achieve the blood sugar. levels into this range and try to bring the HbA1c control to less than 7. Okay, what resources are available to help me control my diabetes? A lot of online platforms are now encouraging awareness about diabetes, and you have a lot of apps which help you to track your blood sugars, which help you to log in your food meals that's happening, and which help wherein you have ability to log in your exercise schedule, your minute to minute activities as well. So a lot of these apps help you to keep a track of what is happening, what is the kind of fluctuations that you're seeing, and because of what changes in the diet or exercise pattern that you're able to know and understand. This will help in identifying the factors where you're falling apart, and then probably set them back again to the control range. You also have a lot of resources online in the form of articles on kind of food that you need to have. What are the favorite best preferred food items for diabetic patients. You have a lot of articles, blogs, which will help you to guide what is the kind of exercise that you have. But there are also a lot of other things coming up online in the form of fat diets, in the form of diabetes reversal apps. So I'll try to address this concept of diabetes reversal here. A lot of people now come to our clinic and ask them, is it reversible? Is it reversible or not? See, diabetes reversal or diabetic getting cured is still a questionable thing. It is definitely possible in certain clinical situations, but it's on a situation to situation basis. But broadly speaking, type 2 diabetes, there is a chance of type 2 diabetes remitting back or going into remission. But again, it depends on the kind of the age of the onset of the condition, the physical state or the underlying health issues of the person, and how strongly he'll be able to be compliant or being able to follow the diet, the lifestyle changes that are being advocated. So all these factors again play a role in deciding whether that is reversible or not. A lot of situations wherein patient get end up having diabetes because of unusual weight gain happening from some months to years, because of the poor lifestyle choices that the patient has made. These are the situations wherein it's definitely a possibility exists. But if the diabetes has been there for a very long period of time and patient has been using a lot of other medications and started to develop other health issues as well, the chances of remission probably is being achieved by a lot of other platforms. But will it sustain in a long term period of time or not is still something we haven't yet seen or explored. So the idea of remission is currently being evaluated and experimented in a lot of different ways by different apps. But the sustainability of it is something we have to see with time only. But yes, there are certain situations wherein remission is possible. So if you're in a situation wherein you're not able to cook your own food, try to balance whatever food that is available with proper share of raw vegetables, raw fruits. Avoid having juices. Avoid having high caloric items like cold drinks, bakery snacks. Prefer more of whole fruits, wherein you will be able to have them along with skin, which will add fiber and vitamins to your diet. Take more of sprouts, which can just actually have them getting germinated. You don't need any cooking for them. Have a portion of nuts and seeds, a mix of all nuts and seeds, handful of them. You can take majority of the nuts and seeds, which will actually are energy dense and good for your heart as well. And you can have more of whole wheat based rotis at night, and have a small portion of rice in the lunch, and breakfast more or less you can rotate majority of the items. When does diabetes become life threatening? Whenever you are at a risk of imminent organ failure, as in you have a massive heart attack, where you have acute kidney failure, when your kidneys start shutting down and they're not functioning properly, you end up having a massive stroke, wherein a lot of area of your brain is not getting adequate supply, or a situation wherein your leg or hand, some infection has become big and started spreading, the entire leg has entered into the bloodstream, and the toxins are going all over your body, wherein a lot of different organs functioning starts to shut down. We call it sepsis. So these are the situations wherein diabetes will definitely become life threatening. So I think I've addressed all of your queries. So in the end, I would just like to emphasize on few things. So after understanding a lot of these things about diabetes, as the adage goes, so prevention is better than cure. So instead of focusing a lot of time and energy on cure and managing it, if we can take a little more time and understand what is possible in preventing the onset of diabetes. So the preventive aspect includes the healthy lifestyle adaptation in the form of diet, exercise, whatever we have spoken earlier, as well as trying to identify the condition at an early stage. That is early detection through your periodic checks happening in the form of health packages, which are now being offered by a lot of diagnostic centers, which help you to understand your metabolic state presently. So where do you stand presently in your metabolic health? This will give you an idea, and it will help you in taking those necessary steps in avoiding the disordered metabolic health from progressing to a full-blown diabetes as well. Uh, I'm just talking about few blood tests wherein they'll help you understand where your sugars stand, where your cholesterol or the lipids stand, where your kidney functioning stands and liver functioning stands. But now even genetics has entered into this field wherein people are identifying genetic messages through gene analysis, which will help in understanding the metabolic health of a person, which will help in predicting the kind of metabolic issues that the person is going to end up in a long term, and also the kind of life changes that he can bring about, suggesting the changes which you can actually give you results and progressing the and avoiding the progression of metabolic health issues. So even work is going on at the level of genetic level as well to understand how much we can avoid these metabolic issues from becoming a big problems in the future. So if you think in this way, at least doing a periodic regular health checkups can help you in identifying these problems at an early age and even preventing them if you are in a kind of borderline stage as well. So early detection, consulting your doctor on a periodic basis, even if the problem is identified, and having them in the close level as much as possible in the best management method, and planning appropriate treatment based on the clinical situation of the patient will help in reducing the burden of diabetes, not only to the person, to the family, society, as well as the country itself. So on this Diabetes Day, I thank Vijaya Diagnostics for giving me an opportunity to speak and increase the awareness of patients on diabetes. And I really wish everyone to take care of your health and stay in a very good shape. Thank you.